Dentistry is defined as the evaluation, diagnosis, prevention, and/or treatment of diseases, disorders, and/or conditions of the oral cavity, maxillofacial area, and/or the adjacent and associated structures, and their impact on the human body, provided by a dentist within the scope of his or her education, training, and experience, in accordance with the ethics of the profession and applicable law. Talking about the history of dentistry, efforts towards the prevention of dental diseases date back to 2600 BC, where an inscription on the tomb of Hesire, an Egyptian scribe, reads that he was the greatest of those who deal with teeth and of physicians. This is known to be the earliest known reference to a person who identified as a dental practitioner, and thus Hesire is often called the first dentist. Moving on, let us now discuss the milestones in dentistry in the Indian context. Sushruta's Samhita in 1000 BC came up with numerous descriptions of severe periodontal disease with loose teeth and purulent discharge. Charaka's Samhita then stressed on toothbrushing with the help of neem twigs. The text talked about how the stick of the toothbrush should be bitter and pungent. Additionally, it also stressed on brushing twice a day, taking care that the gums are not injured in the process by the neem twigs. In 1920, Dr. R. Ahmed founded the first dental college in India, which was financed by starting the New York Soda Foundation in Calcutta. Dr. R. Ahmed is known as the father of dentistry in India, and he later went on to become the first president of the Indian Dental Association. He set up the Bengal Dental Association and the Indian Dental Journal in the year 1925. Later, in 1939, he helped in the formation of the Bengal Dentists Act, which was the first dental government regulation in India. The Dentist Act was passed by the Indian Parliament in close association with the All India Dental Association on the 29th of March, 1948. The then All India Dental Association is known as the Indian Dental Association today. This Dentist Act was introduced to regulate the profession of dentistry in India. The Act was later amended on the 1st of July in 1955 to make the law applicable even to the state of Jammu and Kashmir. The Department of Community Dentistry was started by Mr. Orang in 1971 at the Government Dental College, Bangalore, under the guidance of Dr. Mohandas Bhatt. In 1988, the National Oral Healthcare Program, a project of the DGHS and the Ministry of Health and Family Welfare, was initiated to improve the oral health of the masses, as well as to prevent or reduce the burden of oral disease in the country. The redrafted oral health policy was then accepted in 1995 as a part of the National Health Policy during the 4th Conference of the Central Council of Health and Family Welfare. Finally, in the years 2002 to 2003, the National Oral Health Survey was carried out by the Dental Council of India. Today, public health dentistry in India focuses not only on clinical care, but also on community outreach. Dental camps, mobile dental clinics, and awareness campaigns are conducted to educate the public about oral health, promote preventive measures, and provide accessible dental care to marginalized populations. In conclusion, from its ancient roots to the modern era, dentistry in India has evolved significantly. The milestones we've explored reflect the growing recognition of oral health as an integral part of overall well-being. We hope you had fun learning with us.